Hey guys, how's it going? This is Ulysses with Amici Hospice, and today we're going to go over our death call protocol. This is something that's very important because after providing great quality care, we want to make sure that we end our great quality care with the bang, right guys? We want to make sure that the family is completely satisfied with everything they've experienced with Amici. So here's a little lesson on how we usually do our death calls. So we will get the call stating that the patient has expired by family. It's usually by family. Unless continuous care is going on, then the continuous care nurse will take care of it. If there is no continuous care nurse and the patient was found expired in bed, this is what we do. They'll call the office will get a hold of the nurse. Once the nurse gets the call, we want to make sure that we reach out to the family, guys. We want to make sure that we let them know our ETA. Hey, this is Ulysses. I'm so sorry for your loss. I just want to let you know that I will go ahead and be there in about an hour. Okay, sounds good. On the way there, or basically beforehand, we should have some mortuary arrangements all lined up. This is something that, social worker, nursing, basically the team, we want to make sure that we follow up and make sure that there is mortuary arrangements. Anytime the patient is on hospice, we want to make sure that we encourage them getting mortuary arrangements prior to patient expiring. And I'll give you a quick explanation why. Because at the time of death, the last thing the family wants to do is start searching for mortuaries, discussing prices, discussing plans. When they're really going through a hard time, it's very hard to focus. So it's a lot better if they actually get this information. They get to choose a proper mortuary that they like and they agree with, and they actually know ahead of time, where the patient will be going. If a patient expires and they don't have any mortuary arrangements, we could definitely help them out by providing some local mortuaries in the area. Use something as simple as Google, or we do have a list of many mortuaries that we can provide throughout all the 5 counties. Okay, so mortuary information is very, very important, guys. Throughout your RN supervisor visits, if you want to make sure that the patient has them, if they don't, just a quick reminder to the family or the patient. You don't want to be too pushy because it's almost like they feel like you're kind of throwing them into the ditch, with all due respect, but that's not it. You're basically trying to avoid a headache, last minute. So with that being said, you get the death call, you call the family, you let them know your ETA. Once you get there, you want to check for vital signs, guys. You want to make sure that there's no respirations, there's no vital signs, there's no pulse. The pupils don't react, right? This is when the time of death will be recorded. It's not when the patient passed. It's not when the family called you. It is when you're actually there proving that the patient has expired by the lack of vital signs and everything I just previously mentioned. Once all of that's missing, you look at your clock. Okay, it's 11:30 a.m. This is the time of death. At that time, you call the doctor. You can either text them, give them a phone call, but you do need a reply. He needs to confirm that he received this message. Doctor, patient, Mr. Smith has expired at exactly 11:33 is the time of death. Okay, thank you very much, Ulysses. Okay, this will be the time of death that is recorded, right? Once that happens, we want to go ahead and provide post-mortem care. This is where we remove any jewelry and give it to the family. We remove any Foley catheters, any possible IV lines, oxygen. What we're trying to do, guys, is provide a nice, presentable patient to the family. Remember, this is the last time they're going to kind of see them at their home. So you want to make sure you make them presentable. You go ahead and lay them flat. You fix their sheets. You fix their blankets. If you have an opportunity, get a wet washcloth, wet their hair, kind of just give them a quick brush. This also represents our care, guys. We want to make sure that the patient looks presentable while being taken care of by Amici Hospice. So these are all the things that you do. Any jewelry, you give it to family members. Wedding rings, earrings. Let's make sure that the patient is clean. We always want to make sure we lay the patient flat. because, depending on the time of pickup time, rigor mortis does start to set in. So you want to lay the patient flat. The best way is possibly putting their fingers across their chest, and a lot of families like to put a cross. A lot of families like to put, certain religious things at the bedside. Depending on the county, for the most part, any county, you can just call the mortuary. Riverside County is very special. It is you have to specifically call the coroner prior to the mortuary. And you can call the Riverside County coroner. The coroner will ask you a series of questions. They're all very simple. Sometimes they might not even ask for a patient name, but they will ask, did the patient expire of natural causes? Is there a suspicion of overdose? Was there a suspicion of falls or something that might have caused a death? Is the family at bedside? What time did the patient pass? They're all very simple questions, that you want to answer. At the end of your conversation with the coroner, they're going to do one of two things. They're either going to give you a badge number or they're going to give you a last name of their last name. This would be the agent. It is very important that we document this badge number or agent on Slack, because this is going to be proof that we actually talked to somebody. Depending on the mortuary will ask who you talked to when you call the mortuary, right? So after the coroner and you get this information down, you want to write it on Slack. Coroner called, spoke to Agent Bird at so-and-so time, right? Then you call the mortuary. The mortuary, the family cannot call the mortuary, guys. This is very important. It has to be a nurse, especially a hospice nurse. The family cannot call and start, expediting the process. That's not how it works. The mortuary always needs someone in the medical field to go ahead and call, okay? So if our patient is on hospice, we call the mortuary. They will ask basic questions: name, date of birth, possibly social security, diagnosis, time of death. What I like to do is, before I actually call the mortuary and the coroner, I'd like to pull up my laptop, open up Hospice MD. All the information that they're going to ask is on your Hospice MD cover sheet right off the bat for the patient, right? So you always have that information right in front of you: date of birth, diagnosis, comorbidities, age, all of these things, allergies, if they do ask. So once we call the mortuary, you also got to remember, guys, the mortuary is also always going to ask if there's a 1-story or a 2-story house, if there's steps, if the body is easy to get to during the pickup process. These are all things that you got to have in mind. So when you go do the death call, make sure that you keep these in mind. If you're going up and there's a big porch where there's four steps, you want to keep that in mind. I got to let the mortuary know that there is 4 steps on the porch. And then there's 2 steps to climb before you get to the hallway to the patient's room. Just keep all of these things in mind to make it easy for the mortuary and make it a smooth process. The last thing we need is for the mortuary to show up and they're unable to get to the patient due to the lack of information. So we call the mortuary. And before we call the mortuary, we also want to ask the family if they're ready for the body to get picked up. Sometimes families are waiting on family members to come in from out of state. Sometimes they're waiting for, maybe not out of state, but maybe, a different county. So you can ask the family, is it okay if they pick up the patient? If it's 11:30 now, let's just say, is it okay if they pick the patient up from 2 p.m. and on, or do you need more time? After 4, you can pick up the patient at 4 p.m. Okay, great. I'll let the mortuary know. The mortuary is very understanding and they'll go ahead and accommodate you. As long as it's not like tomorrow, right? But for the most part, they'll accommodate you and they'll wait a few hours for you. We call the mortuary. We give them all the information. We give an estimated weight, steps, 1-story or 2-story. They're going to ask if the patient is at bedside. They will ask for a Amici name and phone number. They will ask for the attending doctor. For the most part, it'll be our medical director. They're going to ask for the medical director's phone number. You give them Amici's phone number. And then they ask if the patient is is ready to get picked up. At this point, this is where you say, doctor, the family is waiting on a few family members. Body will be ready from 4 p.m. and forward. and the mortuary will accommodate you. Once that's said and done, we hang up the phone. We let the family know that the mortuary will be there at 4 p.m. to pick up the patient. You also want to provide any extra care for the patient or the family members. Actually, you ask them, is there anything else I can do for you? Can I get a chaplain to give you a call at this hard time? Just so you don't have to talk to the chaplain now, but we can offer chaplain services, moving forward, for the next few weeks, for the next few months if needed. So please let us know and reach out if you need some more, consults from the chaplain. Once it's all said and done, guys, and you've provided an ETA for the mortuary, you give your condolences to the family. You let them know that if they have any questions or concerns, they can always give us a call. And you ask if there's anything else you can do before you leave. If there isn't, you say your goodbyes, and we close off with some more good quality service for Amici. And this is the lesson on our death call. I hope that this helps, and just give us a call if you have any questions or concerns. Actually, I'm sorry, I forgot one thing. Medication disposal, guys. We do have two options. The first one is disposing the medications at bedside. There is a couple of methods. One, we never throw stuff in the toilet or the sink or the trash. We always want to make sure we dispose of it. One good way would be a diaper, coffee grinds, put the medication in there, throw some water in there, smash it up, wrap it up, plastic bag to close it, and we can throw it away. The next one would be where we educate the family on how to dispose of it as well. If this is the case, we do have a form to where, we have the patients or the family sign just stating that they've been educated and they will dispose the medications on their own. As nurses, we never want to take the medications with us. We want to make sure that we dispose of it at bedside or the family disposes of it. But if the family does dispose of it, we just want proof that they're aware and we're educated on how to do it. Okay? As nurses, we can't have any patient medication with us in the car. If we get pulled over, then, we will get questioned. But that is it, as well as take the binder with you. If the patient wants to keep the binder, I really don't see why they would, but you can leave the binder there. But for the most part, take the binder with you. Make sure there isn't any useful information that the family might want to keep. Give them any paperwork that they might need, and take the binder with you and drop it off in the office so we can go ahead and clean it, recycle it, and possibly use it again. All right. With that information, this concludes our death call visit. I hope it was helpful, guys. Thank you very much for joining us.